I shadowed the emergency department a few weeks ago, and this young man came in excruciating pain. He had gotten a cast on his arm a couple of days prior and was fine at the time. A couple of days later, he started having this excruciating pain. Thankfully, when they took off the cast, things improved significantly. And the team was telling him that it's a good thing that he came in, because had he waited, he could have potentially lost function in that limb. He had something called acute compartment syndrome. And I think we should all know about it, because if it's not treated within 6 hours, it can lead to permanent muscle damage and loss of function in the affected limb. I'm Ida, I'm a medical student and pharmacist. Here's what you need to know about acute compartment syndrome. So it can happen in different parts of our bodies, but especially our arms and our legs. So inside our limbs, we have these compartments, which is an area with muscles, nerves, blood vessels all together, and they're surrounded by this wall called the fascia. But the fascia is not as rigid as a wall. It's more like a balloon. It can stretch a little bit to handle small changes in swelling and pressure. However, if that pressure builds up too much, then it exceeds what that fascia can handle. When that happens, this increased pressure compresses on these tiny blood vessels that we call capillaries, and it deprives the muscles and the nerves from oxygen and nutrients. Without oxygen and nutrients, these muscles and nerves begin to die. So what causes pressure to build up inside the compartments? It's usually after a significant injury, so like a crush injury. It can also happen with excessive bleeding, so people who are at risk of that is anyone on blood thinners or individuals with blood disorders that predisposes them to bleeding. And then lastly, if a cast or a bandage is wrapped around that limb, that can increase someone's risk of having compartment syndrome, which is what happened to the guy that came into the emergency department. So if you have these risk factors, if you need to be looking out for certain signs and symptoms, and when those are present, you need to go to the emergency department. The first is significant pain. So I'm talking pain that is more than what we would expect for that injury. Usually also the pain would increase when that area is stretched, and it's called pain on passive stretch. And then lastly, if the area feels tight, if it's feeling very firm, that is another evidence that you should be going into the emergency department. Because if that's not addressed, the body will then replace this dying muscle tissue with scar tissue, and that leads to a stiff, non-functioning limb called a contracture.